Out of all the health problems you can get, a stroke would probably be one of the most devastating conditions. Today, we're going to talk about blood clots, heart attacks, and strokes. If you want to avoid having a stroke or a heart attack, then you're going to have to avoid blood clots. What do you all think is the number one thing you can avoid to have blood clots in your systems? If your answer is cholesterol, then you're wrong.
Know that you're not the only one blaming cholesterol for every problem. 90% of population watching this video thinks the same. Your body is constantly forming clots and dissolving clots all day long. A clot is called a thrombus. And what makes up a clot? It's 65% fibrin, which is a protein, 20% platelets, also a protein, 10% red blood cells, another protein,
1% white blood cells, which is a protein too, and only 4% cholesterol. Yes, you heard it right. A very small fraction of a clot is really made up of cholesterol. So, consuming cholesterol is not going to form clots and is not going to lead to strokes or heart attacks. Okay, so now we're going to talk about something called PAI-1. It is a compound that blocks something that dissolves the clot. It's an enzyme inhibitor, which means that it blocks the enzyme that dissolves the clot. So we want to keep it very, very low, because when PAI-1 increases, it increases the risk of developing a thrombus. Now the question is, what triggers this compound? It is important to know which food or supplements trigger this compound to avoid getting it in your diet and thereby lowering your risk to getting a stroke. The number one trigger is glucose. Yeah, sugar. Number 2 is insulin. Number 3, cortisol, the stress hormone. And number 4, estrogen. Saturated fats or cholesterol does not trigger PAI-1. Thus, it doesn't play any role in clot formation. If you do research on strokes, it lists the risk factors right and says diabetes, high blood pressure, obesity, atrial fibrillation, which is the dysfunction of the rhythm of the heart, and then metabolic syndrome and sleep apnea. So what do all these problems have in common? Well, these are all symptoms of high insulin, which is a result of consuming diets that are high in sugar. So cutting sugar from your diet is the very first step towards your health and well-being. Okay, so let's talk about the foods that you can consume to prevent clotting and a stroke. Number 1, DHA and EPA. What are those? These are two very special types of fatty acids. They're omega-3 fatty acids. They are in fatty fish, especially salmons, sardines, and cod liver oil. The interesting thing about these healthy fats is that your brain thrives on them. They are involved in certain genes that not only build the structure of the brain, but the function of the brain and the repair of the brain damage.
They are anti-inflammatory as well, so this is very, very important in preventing or avoiding strokes. Number 2, garlic. There is a certain vital nutrient in garlic that the drug companies right now are trying to isolate to use in an anti-clotting drug.
Well, why not just consume garlic? It's a great blood thinner without any side effects. Number 3, potassium. Yes, vitamin K. High potassium diets not only prevent strokes, but is also vital for your kidney health. The best source to get your vitamin K is by consuming leafy greens. However, you can also take supplements to meet the daily required potassium necessary for your body. Number 4, exercise. Vital to increase circulation, not just in your brain, but in your heart as well. Number 5, vitamin E. Very, very important to help thin the blood and the clots, but make sure you get your vitamin E through natural sources and not just synthetic versions. I hope this video has helped you learn some new information. There are a whole bunch of people that really need this information, so please share it with your friends and family. If you enjoyed this video, please like and subscribe and hit the notification bell. Thanks for watching, and I'll see you in my next video.